hemorrhage. What is hemorrhage? hemorrhage هي ده إنه تحبون تعرفون إنه ممكن تنكتب أي إي ممكن تنكتب بس حرف إي فاثنيناتهم صح. hemorrhage is the escape of the blood from the cardiovascular system سواء externally or internally. يعني مو شرط احنا ننزف نشوفه بعيننا وجزء يكون خارجي يلا نعتبره نزف، وبعدين ناخذها ان شاء الله بالclassification of the hemorrhage، ممكن externally او ممكن internally. والهيموريج مو شي بسيط، واذا انترك ممكن يسوي لنا مشاكل كبيره. بعدين ممكن صعب علاجه، ممكن حتى توصل انه مرحله الشوك وفيتل ممكن. فلهذا كل ما عالجنا الهيموريج في وقت مبكر وامور بسيطه ممكن نستغني عن امور خطيره ممكن توصل organ failure or even death of the patient. استمرار الهيموريج ممكن يسوي لنا هايبوفوليميا. الهايبوفوليميا ممكن يؤدي لنا إلى شوك، وهذا إلى يعني العديد من التبعات. ممكن يصير عندنا هايبوثيرميا، ممكن يصير عندنا other organ dysfunction that may affect the health of the patient. Classification of the hemorrhage. There are many types to classify the hemorrhage or the bleeding, and under each type there are sub-classification. We start with the classification of the bleeding or hemorrhage according to the source, and under this classification there may be arterial hemorrhage, venous hemorrhage, and capillary hemorrhage. Arterial hemorrhage, as you know, is from the arteries. The arterial hemorrhage is commonly bright red because it is oxygenated blood, and the bleeding is like pulse, pulsating, not steady jot, not steady flow, and is rarer than venous. More common is the venous hemorrhage, and it is more can be more dangerous, especially if the large artery is injured. While in the venous hemorrhage is darker red, darker than arterial blood, and it is continuous, steady flow. There is exception of the color between arterial and the venous when the bleeding from the pulmonary artery, even it is artery but it have deoxygenated blood, while the venous pulmonary vein it is oxygenated. So not all arterial bleeding it is brighter than venous artery. While from the capillary artery, capillary capillary hemorrhage, it's also somewhat brighter than venous blood, and it's often like ooze, not bleeding from the specific point, ooze from large area, and also but sometimes it may be cause serious bleeding. Examples in when the patient have the coagulopathy, dysfunction of the coagulation, as in some disease like hemophilia, and also in some there is hemangioma, capillary hemangioma, and the bleeding from the capillary hemangioma may be serious. Other classification is according to the presentation. Presentation, as you know, how the blood is escaped from the cardiovascular. Sometimes it is the most common, and it is external or called revealed hemorrhage. When we can see the bleeding or the source of the bleeding. And the other classification is the concealed or internal hemorrhage within the organ, within the chest, within the abdomen, inside the body. Sometimes concealed hemorrhage can be seen or can be changed to the revealed or external hemorrhage. Sometimes bleeding from the gastric ulcer, bleeding within the abdomen, from within the stomach, can be revealed can be seen as bleeding from the anus. So the blood it is concealed لكن ظهر externally from the anus. Also sometimes bleeding within the chest can be by hemoptysis, cupping of the blood, and also change from the concealed into revealed. And العكس ممكن sometimes bleeding within the mouth can be first start with it is external hemorrhage and revealed, but sometimes the patient can swallow this blood, so we cannot see the bleeding, so change into revealed. Classification according to the time after insult. there may be primary hemorrhage, which is the bleeding occur immediately during injury or immediately during surgery, يعني at the same time of the injury or surgery, within the time of the surgery. uh, reactionary hemorrhage is the other sub-classification, is occur within the 24 hour of the injury or the surgery. يعني we continue the operation without the bleeding, and after 1 hour, 2 hour, the patient is rebleeding or a bleeding occur. There is some causes or some the main causes يعني is dislodgement of the clot. يعني at the time of the operation there is a clot obstructing the site of the bleeding, while after when the patient resuscitation blood pressure is increased, so this clot will remove from its site and the bleeding reoccur. And this mostly occur because of the mostly during the at the time of operation there is hypotensive technique, the patient is hypotensive, while after end of the surgery the normalization of the blood pressure is increased, so the clot will dislodge. And also sometimes the patient will during the recovery there will be restlessness, there will be coughing, there will be vomiting. All of these causes can cause increased venous pressure, so causes either dislodgement of the clot, or also either slippage of the ligature. And sometimes even ligature we suture the leader side at the time of the operation, but it is slipped after the operation. This is called assessment of the blood dose is very important. As we say in the start of the lecture, the hemorrhage should be treated immediately and according to the severity of the bleeding. So, how we classify the severity of the bleeding? This is classified according to the size, or according to the amount of the blood dose. Sometimes we can't, like in the type of the concealed hemorrhage, or also in the patient have cannot collect the blood in the same container, so we cannot collect or assess the quantity of the bleeding simultaneously. So there are many points for assess the blood loss. First is if the external hemorrhage is obvious, when the bleeding from the patient in the same time in the same position, and all NDC we can assess the bleeding, whether there is large amount, small amount. This is also only for the external hemorrhage, and when the patient is in the same position, we can't change its position. Sometimes from the blood clot, even sometimes the blood clot will accumulate in the area of the after the surgery we open the abdomen, or even in the mouth, or even in other organ part of the body. So when قبضة اليد أو احنا نسمونها clench fist is about 500 mil, 500 feet. In case of the swelling in the closed fracture, in the fracture in the femur, fracture in the mandible, fracture in any bone of the fracture in any closed area, sometime from this swelling we can assess the type of the blood within this area, but this is a rough assessment. And also sometimes we can wait the swab, and the swab after بعد أن نطرح dry weight of this swab, we can now assess how much blood within this swab. And the last one is from the hemoglobin, and this hemoglobin is the late estimation, because at the time of the operation, in the first day of at the time of the bleeding, even in the first 24 hours, the hemoglobin will not change, because the blood lost from the patient with its hemoglobin, so the hemoglobin in the remaining blood is the same. While after resuscitation of the patient, and IV fluid is given to the patient, and even blood from even fluid from the extravascular part will because of the hypotension, blood fluid will change or move from the extravascular to the intravascular to accommodate the hypotension, so a decrease in the hemoglobin will occur. Management of the bleeding is very important, and management of the any injured patient is by ABC. ABC means A mean management of the airway, B bleeding, and C is the circulation. So the priority in any injured patient for the breathing, for the airway. After stabilization of the airway, we change to the control of the bleeding. Control of the bleeding is start with the identifying of the site of the bleeding, site of the hemorrhage, and try to minimize and control this bleeding site. Then control of the circulation by يعني intravenous access and resuscitation of the patient with IV fluid. Identifying the site of the hemorrhage may be easy and direct in case of the external hemorrhage. We can see directly the site of the hemorrhage, while in case of the internal hemorrhage, we cannot see the site of the hemorrhage, so we can assess the severity of the hemorrhage from the sign and symptom of the patient and try to manage the patient accordingly.